All right. Hi everybody, my name is Shelby, and today I'm going to be performing some suctioning. And the first thing you're going to want to do is make sure that your hands are washed and you've got on clean gloves. And then whenever you go in the room, you're going to just inform the patient what's going on, let them know what you're doing. You're going to want your patient in semi-Fowler's position. So right now I'm using this. You would just sit the bed up. I'm going to use that right now. My patient's forelegs will cooperate with me. Right now you're going to drape the patient. You're going to want to make sure they are draped so that you're not getting anything on them. So to go ahead and explain a little bit before we start, the pre-measurements for this, for suctioning, are going to be for your nasal pharyngeal, which is going to be from your nose to your ear, and that's going to be 3 to 4 inches. And then the nasotracheal, which is going to be your nose to the bottom of your neck, and that's going to be 8 inches. And then the oropharyngeal, which is going to be from your mouth to your ear, and that's again going to be 3 to 4 inches. And then the orotracheal, which is the mouth to the ear to the bottom of the neck, and that's 6 inches. So a normal tracheostomy cannot be measured, but for adults you're going to want it to be no more than 6 inches. So you're gonna, before you start the procedure, you're gonna turn on the suction in the room. And for adults, the suction should be 100 to 150, and children, it should be 100 to 120. So we're gonna go ahead and open our packaging. And it is sterile, so make sure that you open it sterilely. Discard of that. Packaging ripped a little bit, but that's okay. And then you're going to put on your sterile gloves. That didn't happen. And then, so after you put on your sterile gloving, you're going to find your tube in here. And so what you're gonna want to do is you're gonna want to coil the tubing in your non-dominant hand. So you're just gonna coil it up like that after attaching the end, obviously, to the suction on the wall. And then the next thing you're gonna do is to lube it up. You're gonna put it in some sterile saline, and that's gonna act as your lubricant. And your patient, you're gonna want to provide oxygen if the patient is in need of it. And for this procedure, you're going to want to make sure that before, during, and after, you're providing hyperoxygenated, giving your patient some hyperoxygenated time before, during, and after the procedure. And so what you're going to want to do is you're going to insert into their nose. And once it's in there, you're going to want to insert as far as it's pre-measured down on the tube. And you're going to turn your patient from left to right to make sure that it's gone through both sides. And so you want to have this in for no longer than 15 seconds. So you're going to want to pull it out with suction on. And if you need to resuction, you're going to re-lube and with that saline. And you must wait 30 seconds between each time of suction, and you want your suction to be no longer than 5 minutes. And I think that's it. Good thing I just finished my video.
Oh wait, put them on. Put them on.
Hang on, let me stop.